Hello friends, how are you? Welcome to my channel. Today's video is about anesthesia coding. In this video, we are going to see about anesthesia coding guidelines. What are the services not included in the anesthesia course? What is anesthesia reporting time? And anesthesia for multiple procedures. We will go through different anesthesia specific modifiers like physical status modifiers, qualifying circumstances, and anesthesia modifiers. In CPC exam, we will get 4 questions from anesthesia chapter. In order to get 100% in anesthesia chapter, we need to be clear about anesthesia guidelines and also anesthesia specific modifiers. Anesthesia specific modifiers are very important in the examination point of view for CPC exam. Watch the video till end so that you will not miss any guideline that might appear in your CPC exam. Before going into the video, please subscribe to my channel and like the video. Let's start the video. First, we will know about anesthesia. Anesthesia. It is derived from Greek words ani, without, and aesthesis, sensation. Anesthesia involves the use of medicine to induce loss of sensation or consciousness during surgery so that the patient cannot feel the pain of the surgery. Cracking the codes. Anesthesia codes 00100201999 are the anesthesia and associated modifiers play a crucial role in coding services. These codes are used to report 3 main types of anesthesia: general anesthesia, regional anesthesia, and also local anesthesia. These are the services that are included in the anesthesia codes. So we should not report any additional code for these services provided during anesthesia care by the anesthesiologist. What are these services? Usual pre and post operative visits, anesthesia care during the procedure, the administration of fluids and blood, and usual monitoring services such as ECG, temperature, blood pressure, oximeter, capnography, and mass spectrometry. So all these services are included in the anesthesia code. So we should not report any additional code for these services if they are given in the question. If mass spectrometry is done during anesthesia services, no additional code should be assigned as it is already a part of anesthesia service. So we no need to give any additional code. Next, services not included: intraatrial, central venous, and span valve. So if a central venous catheter is inserted during the procedure, it should be represented by an additional code as it is not part of the anesthesia service. So for these services, we need an additional code for the anesthesia care code. For example, during the procedure, during the coronary artery bypass grafting, the central venous catheter is also inserted to patient by the anesthesiologist, means we have to give additional code for central venous catheter along with the anesthesia code. So these are services included, should not be reported additionally. These are the services not included which should be reported additionally. Next, to report regional or general anesthesia performed by the physician, surgeon, and not anesthesiologist, modifier 47 should be used. So if surgeon who is doing the surgery, he himself gave the anesthesia to the patient, then that anesthesia service should also be indicated by modifier 47. It represents that the surgeon itself gave the anesthesia, not the anesthesiologist. Next, anesthesia reporting time. Anesthesia time starts with preparing the patient for induction of anesthesia in the operating room or equivalent area and ends when the anesthesiologist no longer in personal attendance, that is when the patient may be safely placed under post-operative supervision. That means anesthesia time starts when the anesthesiologist prepares the patient and ends when the anesthesiologist leaves the patient to post-operative supervision. So it is anesthesia time means whatever the service provided by the anesthesiologist, that time is called anesthesia reporting time. This time does not depend upon the surgery time. So for example, if the anesthesiologist starts preparing the patient at 10 o'clock and the surgery starts at 10:30 and ends at 11 a.m. and the anesthesiologist left the patient to post-operative supervision at 11:15, then the anesthesia time will be 1 hour 15 minutes, not half an hour. So this is the anesthesia reporting time. This anesthesia reporting time is important in examination point of view. We might get one question in our CPC exam. Anesthesia for multiple procedures. When multiple procedures are performed during the single anesthesia session, anesthesia code representing most complex procedure should be reported. For example, if the patient undergoes knee surgery and skin biopsy during the same session, the anesthesia code for the complex procedure, that is the knee replacement, will be assigned. So knee replacement is a complex procedure compared to skin biopsy. So anesthesia code for knee replacement should be selected, and there is no need to give the skin biopsy code as the anesthesia for more complicated procedure should be reported. Next, physical status modifiers. These physical status modifiers will provide valuable information about the patient's health, guiding coders in accurately representing the patient's condition. These physical status modifiers will represent the patient's health condition, whether he is a healthy patient or he is a patient with mild systemic disease or severe systemic disease. P1 normal healthy patient. P2, a patient with mild systemic disease. P3, a patient with severe systemic disease. P4 is severe systemic disease with constant threat to life. P5 is moribund patient who is not expected to survive without operation. P6 is a declared brain dead patient whose organs are being removed for donor purpose. So these are the physical status modifiers. P1 means healthy patient. We have to remember like this. P1 normal, P2 mild systemic, P3 severe systemic, P4 constant threat to life, P5 not expected to survive with, P6 is declared brain dead patient. So these are the physical status modifiers. In the next video, we will go through qualifying circumstances and anesthesia modifiers list. So if you find this video useful, then please kindly subscribe to my channel and like the video.